Hello guys, welcome to my channel LIZA'S Noble Profession. Today I will teach about IV fluid calculation. When you have an order for an IV infusion, it is the nurse's responsibility to make sure the fluid will infuse at the prescribed rate. It is very important to know how to calculate the correct IV flow rate. When calculating the flow rate, determine which IV tubing you will be using, micro dip or macro dip, so you can use the proper drop factor in your calculation. So what is drop factor? The drop factor is the number of drops in 1 ml of solution and is printed on the IV tubing package. In every drip set packet, the drop factor is already written. In this macro drip set, the drop factor is 20 as written here. And in the micro drip set, the drop factor is 60 drops as written in this packet. So what is macro drip and micro drip? It refers to the diameter of the needles where the drop enters the drip chamber. Here you can easily understand the difference between macro drip and micro drip. First I will explain about micro drip set. Micro drip IV tubing creates extremely small drip sizes for medications that are potent and must be carefully administered, and for patients population that are highly sensitive to large doses of medications. The micro drip factor is generally estimated at 60 GTT per ml. Next, macro drip set. Macro drip set tubing is more standard tubing type and has larger drops of fluid than macro drip set tubing, the standard tubing type, and has larger drops of fluid than micro drip tubing. The macro drip factor is generally somewhere between 10 to 20 GTT per ml. So how do you calculate an IV drip rate? The formula of flow rate calculation is total infusion rate into drop factor by times in minute. If you are calculating ml per hour, the formula is total infusion volume by total infusion time. Here I have given the examples of this formula. A patient is receiving 400 ml normal saline IV over 4 hours using IV drip set with a drop factor of 20 drops per ml. How many drops per minute should be delivered? Here the total infusion volume is 400 ml, drop factor 20 drops per ml times in minute 4 into 60. By using the flow rate calculation formula, we got the flow rate 33 drops per minute. And by ml per hour formula, the rate is 100 ml per hour. Here I have given another example. A patient is receiving normal saline 50 ml per hour using IV drip set with a drop factor of 15 drops per ml. How many drops per minute should be delivered? Here, total infusion volume is 50 ml, drop factor 15 drops per ml, times in minute 1 into 60. So, the flow rate is 12.5 drops per minute. Here I have given another example. A patient is receiving 300 ml normal saline IV over 5 hours using tubing with a micro drip set of 60 drops per ml. How many drops per minute should be delivered? Here total infusion volume is 300 ml, drop factor 60 drops per ml, time in minutes 5 into 60. So the flow rate is 60 drops per minute. I hope you enjoyed my video. Thank you, and don't forget to subscribe and hit the notification bell. Watch my new videos on my YouTube channel LIZA'S Noble Profession.